Hi, Rachel here from Mindshift Psychological Services. Welcome. Here to thoroughly explain what is EMDR. Eye movement desensitization and reprocessing therapy treats mental health conditions that happen because of memories from traumatic events in your past. It's best known for its role in treating post-traumatic stress disorder, but its use is expanding to include treatment of so many other conditions. Just to name a few of those, we have the anxiety disorders. So that's generalized anxiety disorder, panic disorder, phobias, and social anxieties. It's also great for treating depression disorders, major depressive disorder, persistent depressive disorder, and illness-related depression, for example. Also great for dissociative disorders like dissociative identity disorder or amnesia, and depersonalization or derealization disorder. Eating disorders. We have the anorexia nervosa, bulimia nervosa, binge eating disorder. Also good to treat gender dysphoria. That's when you feel as though your gender is different from the one assigned to you at birth. EMDR is also great for obsessive compulsive disorders, OCD. That's body dysmorphic disorder and also hoarding disorder. Also for personality disorders, borderline personality disorder, avoidant personality disorder, also antisocial personality disorder, and of course the trauma disorders, acute stress disorder, complex and uncomplicated PTSD, and adjustment disorder. Eye movement desensitization and reprocessing therapy is a mental health treatment technique. This method involves moving your eyes in a specific way while you process traumatic memories. EMDR's goal is to help you heal from trauma or other distressing life experiences. Compared to other therapy methods, EMDR is relatively new. The first clinical trial investigating EMDR was in 1989. Dozens of clinical trials since EMDR's development shows this technique is effective and can help a person faster than many other methods that we use. Why is this treatment used? Well, EMDR therapy doesn't require talking in detail about a distressing issue. EMDR instead focuses on changing the emotions, thoughts, or behaviors that result from a distressing experience, trauma. This allows your brain to resume a natural healing process. While many people use the words mind and brain when referring to the same thing, they're actually very different. Your brain is an organ of your body. Your mind is the collection of thoughts, memories, beliefs, and experiences that make you who you are. The way your mind works relies on the structure of your brain. That structure involves networks of communicating brain cells across many different areas. That's especially the case with sections involve your memories and senses. That networking makes it faster and easier for those areas to work together. That's why your senses, sight, sounds, smells, tastes, and feels, can bring back strong memories. Let's talk about adaptive information processing. EMDR relies on the adaptive information processing model, a theory about how your brain stores memories. This theory, developed by Dr. Francine Shapiro, who also developed EMDR, recognizes that your brain stores normal and traumatic memories differently. During normal events, your brain stores memories smoothly. It also networks them so they connect to other things you remember. But during disturbing or upsetting events, that networking doesn't happen correctly. The brain can go offline. And there's a disconnect between what you experience, feel, hear, and see, and what your brain stores in memory through language. Often, your brain stores trauma memories in a way that doesn't allow for healthy healing. Trauma is like a wound that your brain hasn't been allowed to deal with because it didn't have the chance to heal. Your brain simply didn't receive the message that the danger is over. So newer experiences can link up to the earlier trauma experiences and reinforce a negative experience over and over again. That disrupts the links between your senses and your memories. It also acts as an injury to your mind. And just like your body is sensitive to pain from an injury, your mind has a higher sensitivity to things that you saw, heard, smelt, or felt during a trauma-related event. This happens not only with events you can remember, but also with the suppressed memories. Much like how you learn not to touch a hot stove because it burns your hand, your mind tries to suppress memories to avoid accessing them because they're painful, they're upsetting. However, the suppression isn't perfect, meaning that injury can still cause negative symptoms, emotions, and behaviors. Let's talk about triggers. Sights, sounds, and smells with a connection or similarity to a trauma event will trigger these improperly stored memories. Unlike other memories, these can cause overwhelming feelings of fear, anxiety, anger, or panic. An example of this is post-traumatic stress disorder flashbacks, where improper storage and networking causes your mind to access those memories in a way that's uncontrolled, distorted, and even overpowering. That's why people with a history of flashbacks describe feeling as if they were reliving a disturbing event. The past becomes the present. So let's talk about reprocessing and repair. When you undergo EMDR, you access memories of a traumatic event in very specific ways. Combined with eye movements and guided instructions, accessing those memories helps you reprocess what you remember from the negative event. That reprocessing helps repair the mental injury from that memory. Remembering what happened to you will no longer feel like you're reliving it, and the related feelings will be much more manageable. I hope that helped in a thorough explanation of EMDR for those of you who are interested. If you have further questions, please do not hesitate to reach out to us. We are happy to hear from you. We're happy to answer any questions, and we hope to see you soon in the office to get started. Thank you. Bye.